As healthcare providers, we are required to wear various levels of PPE. Studies have shown that wearing PPE can inhibit our ability to really be able to communicate with our body language, our messages authentically to our patients. So if we're wearing a lot of PPE, how can we ensure that we're still communicating our message as intended with our body language?
At the Dental MVP, we use science to teach people skills to you, the dental professionals. Do not forget to subscribe to our channel and don't forget to hit the bell so you never miss out. As dental providers, we are covered from head to toe in PPE on our daily interactions with our patients. But right now, more than ever, those interactions are changing even more. I used to be able to go out to my patient and greet them with a handshake. That's changing. And now that I'm considering going back to the practice, it's how can I connect with my patients and still build rapport with them if I can't even touch them?
And if you're wearing a mask the entire time, what is it that we can do to really vamp up the way that we're interacting to ensure that that warmth is still there, that they still know that we are involved in their treatment and that we're there for them?
So let's give you some tips and tricks to make sure that your body language is still communicating, that you care about your patients, and that you're connecting with them.
The first difference that our patients are going to notice as they walk into the practice is that we're all going to be wearing masks. Studies have shown that when providers wear a mask, their patients' level of perceived empathy and their belief of how competent their provider is declines. So if they have that decrease in perceived empathy, they don't think that we're as competent, the likelihood that they will then continue and complete treatment also decreases as well. So knowing that we have this increased PPE, we want to make sure that we have a strong foundation understanding why this happens and what it is that we can do.
So what Chastity is saying is we've lost some confidence, we have lost some empathy, and now we've got to figure out a way to revamp that even though we're wearing all of this PPE. First and foremost, why is it in the first place that just by wearing a mask, we would lose any of that? And that's because we are covering up a really integral part of our face, our mouths. We watch somebody's mouth when they're communicating with us. It helps us to process the information. I'm watching your mouth as it moves. I'm predicting what words might come out of your mouth. And don't forget, one of the most important things is our smile. And that is what we want to make sure that our body language is still going to give us that confidence and our empathy, and there are ways to do it. So let's give you some tips and tricks through all that PPE, how you can still be confident and empathetic with your patients.
So if we first look at the ways that the mask impacts our face, we can see that it covers a large portion. So it covers our mouth, which really impedes our patient's ability to see our micro expressions. So it's hard to tell if someone is smiling or frowning. But it's important to remember that we can still see a smile in someone's eyes. So there is a difference between having a neutral face or smiling, really making sure that as you smile, you're seeing that crow's feet, the wrinkling around the eyes, the brightening in the eyes as well. You can sense that. Also, when you smile, it changes your tonality. So as you talk to your patients, if you go from having a straight across face and just talking versus having a smile, you can hear that tonality become more uplifting. So we want to be mindful of those key components that still have an impact. Christina had a great point of her son had said, "Mom, I keep smiling at everybody while I'm walking down the street, but nobody can see me smile, so I don't know why I'm doing it." People can perceive these smiles. It's in your eyes, it's in your tonality. So make sure as you're interacting, still smile when you're greeting people.
Let's talk about body language and how to show confidence. Like we said, the moment that we put on all this PPE, our patients are having a hard time connecting with us. And we want to show we are still their providers. We still are competent individuals to be taking care of them. How can we do that? Well, first and foremost, I want to call out for a moment that during this time of uncertainty and new protocols and new procedures, you've got this checklist. And we're going to feel like we might not be doing as good of a job as we normally do. For hygienists specifically, they might be hand scaling instead of ultrasonicking. And this is kind of untapped territory. They might be using an HVE that they don't normally, and they're feeling uncertain. And so what we might find ourselves naturally doing is having our bodies show that as well. So our patients are already going to perceive us as less competent. And if we're not feeling competent, we're really going to show it. What that's going to look like is your shoulders usually going to come down and in. So practice this right now with me. Just kind of pull your shoulders down and in and looking down, not really holding our bodies up strong. this is making us feel like we're just not really feeling comfortable and confident with what we're doing. So what we want to do is be super mindful of that. Our patients are looking for that. They're noticing that, and they're already feeling a disconnect. So make sure to pull your shoulders back and down instead of forward and down, and really hold your chin in a neutral position. So that way your head is just right level with them. Stand tall, stand towards them when you're having conversations to show that you are fully present in the conversation. This is going to help you to look more confident and more confident moving forward.
Tying into the empathy component of it, don't forget we have access to using our hands. Our hands are one of the greatest ways to be able to show our intention, to let our patients know that they can trust us and feel comfortable and secure with us as a provider. Now, of course, during this time, handshakes are off limits. We really want to be maintaining social distance where we can be, but that doesn't mean that we can't use our hands. There is always the casual wave as you walk out to the waiting room to say hello. Once again, a simple wave, this gesture lets patients know that you care about them, you're acknowledging them, and that you're here for them. It really says, hey, I'm your friend. I'm here to care for you.
Let's continue this idea of empathy. So like Chastity said, there's different ways that you're going to be able to greet people. And we're going to use tonality and making sure that we're smiling with our voices and waving. What else can we do from an empathetic standpoint to make our patients really connect with us? Well, our hands are the first thing that people look at when they see us. So we want to make sure that we show these hands as much as possible. And why? We might be starting to wear gowns and they might have pockets and we might not be used to this and we're feeling uncertain. Watch out that you don't start slipping your hands away into your pockets. If we're hiding our hands, again, that's going to reduce our confidence as well as our empathy. So we want to make sure that we continue to show the hands. We also want to use our hands.
Yes. So when patients look to us, they typically look at our mouths as well as we're talking, and they're interpreting what it is that we're saying to them. Now, with a mask on fully throughout the day, they're not able to do that. But don't forget that your hands can be used as a way to express congruency between what it is that you're saying and what it is that they're interpreting. So you can use your hand motions for explanations. This reinforces trust, lets them know that you're empathetic. We want to be mindful. There is an appropriate way to use your hands. Keep in mind that there's a strike zone. So really keeping your hands within this region. We don't want to get too crazy and boisterous with our hand motions, but really just outlining the concepts that we're explaining through the use of our hands.
Now, what does this look like, using our hands to communicate? Because our mouths, they can't follow along with it. Well, you can use it for size, for example. So use your hands to say small, large, again, keeping within that frame. So we don't want to say large, right? But it helps them follow along. So if I say you've got a small filling, then we can use our fingers to say that. I'm going to get you scheduled for one more appointment. Go ahead and use your fingers for numbers. 1, 2, 3. Use your fingers for those numbers. You can also do it for length of time or sequential kind of reference. If you're saying like, we're going to do this in stages, there's different ways to show that with your hands. We're going to do this over time. This is showing it a length over time. So use your hands intentionally. This might not be something that you've ever really thought of. You might be somebody who just talks with your hands anyway, or you may be somebody who normally tucks your hands away. But now more than ever, we want to be intentional with our interactions with our patients and know that we have to show that confidence and empathy some other way, and our body language is the way we're going to do it.
And lastly, a great way to show that you are involved and empathetic to your patients is with active listening, and doing this with your body language as well. So as they're talking to you, you can lean in. Of course, we want to keep our distance, but leaning in to show that we're listening. This might be a slight turn of the head to position your ear towards them, facing in their direction, making sure that you're making really great eye contact, even though we know that there will be the barriers of maybe loops and shields, but letting them know that you are fully engaged in what it is that they're saying. This involves pointing your feet towards your patient as well. This is going to ensure that you're positioning your body language directly towards them and showing them that you're engaged in what it is that they're saying and their concerns, and making sure that they're comfortable throughout the appointment.
Now more than ever, we're going to want to be on the same level of our patients. So if they're laying down, we want to sit them up. We don't want to show any sort of authority there we want to be able to be on the same level when we have conversations. And especially since we're going to be muffled by all the different things on our face, we don't want to be behind them saying, what day and time for that appointment? We want to be right in front of them, connecting with them, and really trying to build that relationship as much as you can through all these layers that we have.
Now, being realistic as well, we're also going to be using lots of other adjunctives during this time. We might be holding a high volume suction while trying to manage other devices. It's probably not realistic to say that in any way we would ever be able to talk with our hands during those circumstances. So sitting your patient up gives you the opportunity to really be expressive with your body language and step it up a notch, knowing that the PPE might be preventing that ability to build that empathy and rapport with your patient.
What we want you to get out of this video is that you still have the ability to connect with your patient. Your tone of voice and your body speaks volumes. So do not forget that. Just because you yourself visually are hidden underneath multiple layers does not mean that you cannot still be present to your patient. I hope that this helps you during this time of uncertainty, and I hope that you're able to reconnect when you reopen your practice. Did you like this video? Make sure to leave us a comment. Tell us what creative ideas have you been coming up with in order for you to still reconnect with your patients. Don't forget to subscribe to the Dental MVP.